Hi, Emma. Thank you for seeing me today. I'm coming to you with my Australian male client, Sam, who's 26 years of age, who's presenting him with executive dysfunction, a form of distractibility, and an inability to stay on task and forgetfulness. Initially, I hypothesized that Sam was experiencing these executive dysfunction difficulties because of ADHD. Immediately assumed that, and that was leading to his social anxiety. However, sort of had more consideration for the full picture with his history of family trauma, neglect, avoidant coping, and confirmation of his assessment results. That led me to refine my hypothesis that his social anxiety is rooted in family trauma, and that's the root cause for his cognitive impairment. So Sam's sort of heightened symptoms in settings involving his performance and in front of others sort of highlights that there's a strong link between executive dysfunction and increasing levels of worry. Uh, Also, I suggest that sort of Sam's affinity with more interesting things and task switching could also be a result of some comorbid depressive symptoms manifesting from a depletion of dopamine. So, what I'd like to do for the treatment goal of the next session is I believe Sam's social anxiety is a result of the family trauma. So, it seems sort of pertinent to me to create a treatment goal that focuses on tackling his avoidance of social situations whilst also being mindful of the nuances with his inability to confide in his family, his support network, and those long held views of suppressing his needs. Feelings of I don't matter. So I feel like a multifaceted approach across sessions will be sort of advantageous for his, interwoven with psychoeducation around trauma and family dynamics. So I'd also like to place a greater weight on Sam's autonomy by reflecting with him on what he'd like to work on and providing options within that realm of treatment to reinforce our therapeutic alliance. The treatment goal would then transition into investigating ways to change the relationship between his belief of I don't matter, accept the feelings of worry across situations, and also implement emotion regulation strategies. So for the chosen modality, after doing some research, I came across a randomized controlled trial that supported the use of acceptance and commitment therapy, best suited for comorbid social anxiety disorder presentations. So I felt like the Hexaflex model of ACT seems like the best approach for Sam in the multifaceted approach I was talking about earlier. And the 14 years minimum he's been feeling like his needs haven't been met, and the executive dysfunction issues as well, may make it difficult for him to understand the difficult emotions he'd need to challenge and identifying them in a modality like CBT, cognitive behavioral therapy, even though it has the greatest amount of level one evidence for treating social anxiety disorder. So I feel that in Sam's situation, CBT and ACT are equally weighted, and I feel like ACT is more appropriate in this circumstance. I feel that if Sam can also come to terms with his lack of family support and managing the anxious feelings in heightened settings across different situations, this will allow him to tackle the space to tackle his sort of ingrained core belief in future sessions. I believe ACT also seems like a better route, as there's very little of his language that is focused on Sam himself personally, with most of his concerns based on external situations and things out of his control, rather than like, oh, I'm stupid, I'm unlovable. It's more his needs aren't being met. So I'd recommend bringing in CBT as a therapeutic modality a bit later on when Sam's possibly ready to challenge the automatic thoughts around his core belief and feels like his executive functioning is up to the task in his mind. So alternatively, there'd also be an earlier shift to CBT depending on the efficacy of ACT, and I'd monitor that throughout our sessions. So also reflecting on client and clinician factors through this process. Diagnostic overshadowing bias was a clinician factor for me that became apparent in the first session, where I immediately attributed a ADHD diagnosis for Sam, but overlooked the full picture of his family trauma, his and the subtleties his way his social anxiety was presenting across situations. So it was helpful in that circumstance to note his age, coming to me at 26 years of age, and no history of troubles at school sort of meant there was a more directional relationship between his social anxiety and executive dysfunction. Uh, Another clinician factor I'll need to be mindful of is that I have an affinity towards Sam's case with also an absent father and a overbearing mother. Uh, so that may result in strong urges for me to solve this problem quickly. Being aware of my own bias through treatment is going to be really important. So it's going to allow Sam to progress through therapy at his own pace. And I've used tactful moments of self-disclosure where I can, which will hopefully counteract rising feelings of pressure on our therapeutic relationship overall. And also, according to Hayes, it's extremely important for the therapeutic relationship to be equal. And my circumstance could also be serve as an important for serve really to improve the treatment's efficacy overall. Uh, with regards to client factors, so Sam may also continue to have difficulty being vulnerable with myself, and this could elongate treatment and require more sessions. But I'll monitor his financial position throughout treatment and aim to track his improvements through self-monitoring and feedback. The strain on Sam's relationship with his mother is also another factor I need to take into account with the external pressure that he'd be placing on him between sessions. To negate this, his mother's influence, I'll sort of help Sam to diffuse with his mother's frustrations and psychoeducate him on language that could possibly rebuild a supportive connection with her. And sort of rather than further isolating Sam at home might be helpful in that regard. And we'll address that in future sessions. The step-by-step plan that I have in mind that I'd love your thoughts on. So initially, I'd like to check in with Sam about how he's feeling about the following options I'm about to tell you, and I'd like to aim to give him more time to the points that he emphasizes or he highlights as I'm listing them. So what I'd like to suggest is, number one, spend 5 minutes in a grounding mindfulness exercise so that Sam's sort of able, to the best of his ability, to acknowledge any difficulties of the day and be more present for the rest of our session. It'd be an exercise suggested by Dr. Alok Kanaljar, Dr. K, and it's called alternate nostril breathing. So basically you perform a shuckers and then press your thumb into one nostril and breathe in and out, and then you switch and do the same on the other side. And that focus helps calm down your parasympathetic nervous system, and it's a great rapport builder as well. It's, something just interesting one. Then step two would be to Hayes actually recommends doing values clarification work before any other ACT components. So I'd like to take Sam through Brene Brown's value exercise, which is a PDF, and that takes about 10 minutes or so. Number three would be, as Sam's sort of a gamer, I can connect with him on this a lot. And I'd like to psychoeducate him on family, chosen versus blood, trauma, social anxiety, executive dysfunction, using his favorite game that I would have found out through session one, maybe even session two. If I didn't find out what that was, and that way we can use analogies that are exciting for him and also build rapport at the same time. Number four would then be a flow and interweave with step three, using cognitive diffusion and emotion acceptance exercises, where we'd spend the next 10 minutes highlighting specific experiences for Sam that come up in that earlier discussion and learning to step back and accept what is and practice emotional regulation techniques in those examples. And then finally, I'd like to spend the last 10 minutes working with Sam on a commitment schedule. So 2 social outings per week with his friends until our next session, even when he's feeling anxious or overwhelmed. That way, I believe he can tap into his sense of safety again. And it's not as big as a jump of work interviews, or I think with the graded exposure therapy research, starting in a space where he's not going to have such a huge drawback if something goes wrong, because he's through the case study, his friends are quite a supportive network still. And selfless context and contact will also be addressed in later sessions. I just feel like it should be the more philosophical psychoeducation should be left for later parts of therapy when he has a better understanding. So thanks for your consideration today and your help. Please let me know what you think of my approach, and I'll hopefully speak to you soon.